Good afternoon, everyone. As we have people joining, we're going to give a brief introduction. So, welcome to the Center for Arizona, or the Arizona Center for Rural Health State Office of Rural Health webinar series. On the next slide, we have some just basic information on the webinar series. The audience will be muted during the presentation. We encourage you to continue adding questions into the question box, and those will be addressed at the end of the webinar. And lastly, you'll receive an email post-webinar with a survey link. This survey really helps us gear our information and gauge what we're giving you in the webinar series. So please take a moment to fill this out. It is really beneficial. And with that, I will hand it over.
Morning, everybody, or afternoon, and welcome to our presentation here today. We're calling it Far Out, Cannabis in Rural Healthcare in Arizona. I am Sean Cronin, and I'm the program manager for the AzCANN program, which is the program presenting this training today. And I have a background in public health and education for the community, largely on the lines of suicide prevention, sexual health, and substance use disorders, with an emphasis on LGBTQ inclusivity. I've also done a lot of work in literacy and other community health programs over the years. So I'm happy to be here and happy to share some of this great information. Before we begin, I will respectfully acknowledge that the University of Arizona is on the land and territories of Indigenous peoples, and today Arizona is home to 22 federally recognized tribes, with Tucson being home to the O'odham and the Yaqui. Committed to diversity and inclusion, the university strives to build sustainable relationships with sovereign Native nations and Indigenous communities through education offerings, partnerships, and community service. So AzCANN that I mentioned is a cannabis education program delivered by the U of A and our Comprehensive Center for Pain and Addiction. And that's funded through the Arizona Department of Health Services and part of the taxes that are collected through the marijuana program here in Arizona funds programs like this. So you'll also see a number of beautiful illustrations, and those were created by a illustrator and artist, Galen Dara, who was on our team in the first year of this project and really helped us make these slides beautiful. So thank you to Galen Dara. If you're curious about their other illustrative works, there is a link, or there is their information. Before I get started, I just want to welcome you all and kind of see where we're all coming from. So if in the chat you wanted to share just your name, pronouns, and where maybe the county that you're joining us from. See things coming into the chat.
Nothing quite yet.
Nothing quite yet. Well, if things start to trickle in, I'll call it out. So a bit of background. In Arizona, we've been hearing cannabis debated for a while, over the last decade and a half. The medical marijuana program was passed in 2010. So of course we were hearing about it prior to then, but it was passed in 2010. The conversation kept going. More legislation was introduced in 2016 of recreational use, and that was rejected then before it was ultimately passed in 2020 under the name of adult responsible use. And since then, we see this commercial model, and so we're seeing cannabis messages from all kinds of sources, including retailers, public health officials, and other folks who stand to make a lot of money off of cannabis consumption. So now that it's legal, we just want to help folks have some helpful language and some information so that we can help Arizonans make responsible decisions about cannabis. So We'll go over some of the laws for cannabis today, some of the trends of the use, what's out there, and we'll go over a tool for engaging patients in self-directed decision making. And for each of the sections, I'll spend a second and zoom in on how this might relate specifically to rural communities. Oh, thank you, Mariah. So it looks like the chat was muted, but folks should be able to share now. So if you wanted to share your names, who you are, a little uh, and where you are joining us from, that would be great. Alicia, good to see you. Bridget, good to see you. So the basics are that Arizona has cannabis legalized for both medical use and for responsible adult use. And so sometimes that will be referred to shorthandedly as recreational use. Um, and there's just some different nuances about why some states use one program, one kind over the other. But we refer to it as responsible adult use. And they're subject to slightly different ordinances and policies. So we'll go over some of the differences now. Hello, Josh, Cochise County, Center for Rural Health here in Tucson. Hello, Pam, Rosie, Santa Cruz County. All right, we're getting out into those rural counties. Good to see you all. I look forward to hearing your thoughts later. So medical use is available to those who have obtained a medical marijuana card after having been certified by a physician as meeting one of these qualifying conditions. Um, of these conditions, the most commonly reported by far is chronic pain, and that represents about 94% of medical card holders in Arizona as of September this year. Cancer is number two, so just think about this. The number two is cancer with 2.4%. So a lot of people reporting chronic pain as a reason why they're seeking this medical marijuana card. So some of the differences, the age for responsible adult use in Arizona is 21 years of age, so the same as alcohol, same as cigarettes. At that age, no medical card is needed. There are no patient fees, etc. And then for medical use, if you look over at the box on the left, a physician would provide a diagnosis from a list of qualifying conditions, and the patient would be able to use that certification and purchase a medical card. Those costs $150, and those are good for 2 years. That allows them to access the medical marijuana program and the different ordinances there. So under recreational use, we'll talk a little bit about acquiring cannabis. So when you're going to a dispensary under recreational use, you can purchase up to 1 ounce of flower at a time or 5 grams of extract or concentrates, and then about 100 milligrams of edibles. And each of those edibles needs to be in a 10% or a 10 milligram kind of serving. So it can't be stronger than 10 milligrams in a single gummy, for example, and the package can't be more than 100 milligrams. Uh, Adults can grow up to 6 plants as long as they are closed and behind a locked door and not visible to the public. So if you're thinking, closed greenhouses, so you can't grow them in your front yard or even a backyard that might be visible from the street. It would have to be closed from public view, behind locked doors, just inaccessible. For medical patients, those amounts are different. So the amount that they are able to purchase within a 14-day period is 2.5 ounces spread between different product types, and just all of the usable marijuana. So all of the THC or flower weight will not exceed 2.5 ounces within 14-day periods. And currently, kind of with a rural rural folks in mind, delivery of cannabis products is available only to medical card holders. And if that if that's a service that the dispensary provides, it's usually done through a third party. So it really just depends on whether the dispensary somebody's interacting with will provide delivery and will provide delivery to that location. Um, and then ADHS is also giving a timeline to create regulations for recreational delivery by January 2025. And so we'll know more about those ordinances next year as those are worked on and agreed upon. But right now it is only available for medical patients. So for possession of cannabis, the medical card holders do have access to higher potency products, so products with higher percentages of THC. So for example, a serving size for the recreational gummy or chocolate square, 10 milligrams, with a maximum of that 100 milligrams in an entire package. However, an edible for medical card holder can be much stronger. It can be um, at 20 milligrams, 30, 40. However, uh, it's interesting to know that also that patients under 21 with qualifying conditions who have a medical card can access cannabis products. And so while recreational use is just available to people over 21, um, folks under 21 can use cannabis products if they carry a medical marijuana card. They can also grow up to 12 plants if they're over 25 miles from the dispensary. Um, and in 2016, ADHS published a map estimating that about 97% of Arizonans actually do, in fact, live within a 25 miles of a dispensary. Um, so that can be good news if we're thinking about accessing quality and regulated products. But for those 3% of folks, um, those they might have the ability to grow more plants. And possession of recreational use is not available to children. I've made that point. Um, and so here's just those amounts again, more visually for retail sale limits and for medical sale limits. There are still some penalties for cannabis. Possession above the legal limit is uh, for 1 ounce is a petty offense. However, above 2.5 ounces, and you're subject to the current criminal code, which would be a felony. If you're under 21 years of age, possessing even small amounts, it's set up as a three-strike system. So the first offense would be a fine of $100. The second time is a petty offense. And then the third offense would be a misdemeanor. Qualified patients, however, are not subject to these penalties. They are kind of limited to those 2.5 ounces within a 14-day period of medical grade products. However, if they were to if they were to reach that limit, and we're still looking to make a purchase, they could make a recreational sale purchase. It would just be subject to taxes. Still, just because it's legal doesn't mean it is a free for all. So employers can also require an impairment-free workplace, especially for positions that require the operations of heavy machinery. And public smoking of cannabis is not permitted. So for example, in the University of Arizona, we prohibit the unlawful manufacture, dispensation, distribution, possession, or use of controlled substances. You can't smoke on the streets, in the parks, on the bus, etc. And of course, it is illegal to drive impaired. It's because it impairs both yourself, puts yourself at risk and others at risks. And aside from those physical risks, it's a no tolerance state for impaired driving, which is defined as driving any vehicle while under the influence of any drug or combination of liquor and drugs in the slightest degree, if they're impaired to the slightest degree, or while the drug or its metabolite is in the person's body. And that last bit is pertinent with THC because metabolites can remain in the system for some time and up to a month or longer. So they're always trying to get better and better at identifying how much of the metabolites in the system are recently metabolized THC. Some other states have per se laws. So, for example, Colorado, similar to alcohol, the 0.08 limit, and they have a similar one with THC, but Arizona does not have that. It's any amount. If any amount in your system could be subject to a DUI. Medical marijuana holders for that metabolite bit, they do have some affirmative defense against this type of DUI. So if they are carrying a medical marijuana card and they're pulled over, it's determined they have some under the system, but they weren't pulled over and driving erratically, they might have some defense there. So even though it is zero tolerance, it's helpful to estimate how long folks should wait before they're no longer impaired. So this is a guidance used by the Colorado Department of Transportation and recommending to wait at least 6 hours after smoking 35 milligrams of THC, which depending on the strength, depending on the person rolling or how much you're smoking with your inhales, about half of a joint. And if somebody uses more, you might flex that 6 hours a little bit more. And if people use, and then 8 hours after an edible. If somebody uses more, you should, or stronger amounts, you might just kind of bump it up. Just remember, if you're feeling different, you drive different, and any amount of your system can still result in a DUI in Arizona. So looking specifically in rural considerations with these law, I just want to call out again the native lands here in Arizona. There are 22 federally recognized tribes in Arizona, and they all have their own ordinances about cannabis. In fact, on most of these tribal nations, cannabis use and possession remains illegal, including the Navajo and the Gila nations. The only nation within Arizona that I'm aware of that's voted to allow cannabis is the Salt River Pima Maricopa Indian community in Northeast Phoenix area. As far I think the rest still have it as illegal on tribal lands. Another thing that might be of particular interest for folks in rural areas in Arizona and urban areas, but it's just a reminder that cannabis is still federally illegal. It's a federally controlled substance. So for folks who interact with federal agents, whether through border control or immigration agents, possession or admitting the use of cannabis or possession could affect immigration status. You could be subject to federal charges. So just remembering that some folks have kind of a different relationship with federal agents and making sure they're aware of that difference in the legality of cannabis is important for folks to understand. And I also want to take a moment to close out as we're talking about justice and penalties that we're going to talk about azexpunge.org. Which is helping folks expunge old charges for cannabis use or possession. And so expungement is the process to have records, including convictions or arrests, sealed from public view and no longer visible to law enforcement. So it really nullifies those past arrests and convictions if your case meets those requirements. So you can check out their website for more details. They have clinics around the state, and they have calendars for that. So to clinics, pop-up clinics around fairs and parks to help answer people's questions about this. And it could help folks overcome some of the barriers they might have after a conviction. It's important that folks realize that this is not automatic. It does not automatically apply and go back to those charges. It must be initiated by the individual. It is free to file, and while you don't need legal representation, it's recommended, especially for folks who might have immigration concerns, to talk with lawyers beforehand and be really engaged during that process. We don't want to accidentally be creating uncomfortable experiences for folks trying to get an expungement. So here are examples of some of those benefits one more time. The eligible charges for expungement are mainly related to possession of the product and paraphernalia, possession up to 2.5 ounces. It does not apply to any federal charges for cannabis or any tribal nation charges, so those would not be able to be expunged. If the original charge was possession for more than 2.5 ounces, or if it was for a DUI, those would not be eligible. Selling cannabis, the expungement, so if you were arrested with a charge of selling cannabis, that would be under review. So might be worth talking to somebody from AZ Expunge to see how those types of cases have been going. And could be worth talking to counsel if that's the case. Again, it's a social justice issue to have people go and find out what can the law do for them to get these charges off of their record. So cannabis use is not one size fits all. Each affects the body slightly differently. So I'll take a quick break from talking for a couple minutes, and I'll show you this video about cannabis affecting the body, and then we'll go into talking about product trends in Arizona.
Did you know your body makes its own THC? Your endocannabinoid system creates and uses chemicals similar to the THC and CBD found in cannabis. We are still learning about all the things this system does, but we do know it has a big impact on our memory, sleep, digestion, and other important functions. For young people and teenagers, it is important to know that adding external substances affects your developing brain and body. If someone does choose to use cannabis, remember each method affects you slightly differently. The method you choose influences the speed it takes effect, length of effects, and the amount of THC in your bloodstream at one time. Smoking hits quickly, lasts about 4 hours, and the THC in the blood doesn't spike as high as vapes or concentrates. Vaporization also hits quickly, with higher spikes of THC. Edibles, on the other hand, are slow to take effect, last much longer, and reaches full effect over time rather than all at once. For someone who uses cannabis, it is important to consider what these differences mean when deciding how to use responsibly. For example, because smoking takes effect quickly, it is important to go slow so you can notice if the effects are too strong. This allows you to slow down or stop if needed. However, like smoking any plant, it contains tar that might affect the lungs. Vaping might have less tar, but has other chemicals and high temperatures that can hurt the lungs. And high spikes of THC increase the risk of cannabis toxicity, uncomfortable sensations like paranoia or psychosis, another reason to go slow. And while edibles release their THC much slower, sometimes someone might try to take more thinking it's not working, causing uncomfortable highs that can interfere with your commitments by feeling the effects longer than planned. Using too much of any cannabis product can cause these uncomfortable effects, sometimes called greenouts, and over time, frequent use can disrupt the development of our brains and bodies. Remember, Even though not everyone that uses cannabis will develop a cannabis use disorder, there are ways to use more responsibly to decrease your risk. The best way to prevent future issues is to not use or to wait as long as possible before trying cannabis, while our brain fully develops at about 25 years old. You can also choose to use only licensed products, use in small quantities and lower strengths, and to use not very often. No matter what you decide about cannabis use, make sure to stay informed, stay safe, and be the best you can be.
I want to just take a second as well to say more and more products are coming out onto the market that aren't just cannabis as we think of it. There's also hemp products now. So um, this information won't necessarily show that, but I want to put that out there that poison control calls for cannabis are going up, are increasing, especially since hemp products have been taking more of a foothold in the market as a result of a federal change called the Farm Bill, which allows for the use of hemp products derived from hemp. So hemp being defined as having less than 0.3% THC in a cannabis plant. Um, and those are being synthesized, the THCs are being synthesized, the CBDs are being synthesized and creating these sort of THC adjacent chemicals that are not well understood. They still create toxic effects. They still may result in a positive drug test. However, the public perception is that these might be not not psychoactive because it's hemp, right? It's not the cannabis plant, it's not the marijuana plant, it's hemp. Or they might think it's less strong. But so just kind of putting that out there. But over the years, there has been a trend towards these stronger and more concentrated delivery forms. And so you can see in 2019, dried flower use compared to today is decreasing, that maroon color. And edible and vape cartridges especially is increasing and is currently the highest percentage of products being used. Those are the navy and the orange boxes. We also want to think about our sources. So those definitely matter. Products from regulated dispensaries and unregulated sources are not the same. So depending on the market, maybe an online market, for example, there's much less, if any, protections from unregulated sources. So here's an example done of products available in California. And you see a handful of products that were not subject to compliance testing. Um, Many of them won't even make a list of THC potency, so you have no idea how strong of a product you're getting. Um, and then they test at relatively high strengths, so 75%, 70%. And then there's another example here at the bottom saying that, oh, this is a 90%, 99% THC, and then it tested for 26%. So it really is unclear when you're buying products from different marketplaces. And aside from potency, these products also had high levels of contaminants and pesticides. Whereas products that were undergoing testing, um, this you can see that they match up. The claims more or less correlate to the actual tested strengths, which allows people to make choices and hone in on the doses that work for their goals, whether those be medicinal use or for recreational use, and feel more confident that they're not introducing contaminants to their bodies. So dispensaries are, preferable for that. They have that sort of uh, that sort of assurance that there's been some kind of quality control before it gets to you, so you can make some choices. ADHS is doing those regulated products for things such as potency, pesticides, heavy metals, salmonella, aspergillus, E. coli, and mycotoxins. And news releases from ADHS, if there's ever been a recall, those are usually coming from ADHS as news releases, and so you'll see those on their website or sometimes coming in over the news. So from a rural perspective, thinking about products, trends, and making sure the safety of buying from a dispensary. Well, from a rural perspective, the recommendation can be tricky to buy from a dispensary because distance can be a barrier. So this might encourage people to grow their own plants, acquiring through online markets or other informal markets. And so just as a reminder to folks who are in rural areas, it is illegal to advertise cannabis for sale without a license. Even though, you're allowed to grow your plant, you're allowed to kind of, smoke your own plants, and have that as, your own personal product, it is illegal to advertise sale. That being said, studies show that this sort of illicit cannabis does have a greater risk levels of containing contaminants such as fungal contaminants like aspergillus, which can cause infection, and they are more common on illicit cannabis flower. So smoking homegrown cannabis makes you 3.5 times more likely to develop a fungal infection like aspergillosis and tends to be among the immunocompromised. So not surprisingly, a few studies have found that illicit cannabis samples contained more of those contaminants. And here are some examples of patients who are at increased risk to aspergillosis, cancer, HIV/AIDS, transplant patients, diabetes type 1, and even COVID-19 can make you more likely, if you're smoking flower, to contract aspergillosis. So again, really important that we're thinking about the quality and the regulation of our products. So as I wrap up, I just want to remind ourselves that folks use many reasons, cannabis for many reasons: physical, mental, spiritual, ritual, recreational, and that use or even misuse does not necessarily qualify as a substance use disorder. Here are some of the other reasons why folks use. You can see that pain is one of the highest physical symptoms that people report using cannabis for. Anxiety and depression is one of the most common mental health symptoms that people report using for. Please note that's not to say that cannabis is absolutely indicated for all of these symptoms. It's just that these folks are reporting using it for these symptoms. So we can't say for sure that cannabis is the right treatment for all these things, just that people are using that. And it reminds us that risk is contextualized by people's family situation, medical, legal, social, cultural, and professional contexts. And it's just not as simple as a linear progression of non-use to heavy use, no risk to heavy risk. So we want to consider that as well. Here's a stoplight activity when we are engaging the folks we serve to help us center their thinking and decision making. It guides their conversation with the patient or a person that you're interacting with. If they're expressing an interest in changing their cannabis behavior, to identify their own green, yellow, and red lights. Green being the patient's description of what life looks like when their use is aligned with their personal goals. Yellow is what it looks like when their goals and use are starting to get out of sync. And then red could be when their level of use is actively moving them away from their goals. Maybe it's time to see a professional. And so we encourage future healthcare providers to work with the patient to identify some next steps to help them move closer to green if they're in a yellow or red space. Joining a club, seeking medication for anxiety or other mental health treatment, other things that help them reduce, the role that cannabis was playing in the treatment of those issues. So that's about it for me today, and I thank you for letting me kind of go through and tie it to a rural experience. And I'm curious if we have time for any other questions, Mariah. Sorry if I went a little long.
No, you absolutely have time for questions, and we'll let some members put them in. I was curious, however, with the information that's been coming out about opioids, do you see cannabis being prescribed for that chronic pain more often than opioids, or is there a progression at any point of the education around it?
Thanks for that question. It's a really good question. I know recently there has been more studies showing that patients are reporting that using cannabis helps them reduce cravings for opioids. So in their own recovery process, they are including cannabis. I know patient providers are reporting that there's still a risk for cannabis use dependency. So even if you're becoming treated for recovery in opioids, using cannabis still has the risk of some dependency, but it's a harm reduction trade-off, right? Um, the risks for the acute risks certainly for opiate use disorder might outweigh the acute risks of a cannabis use disorder. But a lot of it could still create, a dissatisfactory um, kind of quality of life depending on the patient's goals. So if that's what I'd say. It really is like, what are the patient's goals? And if their goal is to kind of transition out of um, use seeking behaviors, you might have a different calculus than I'm just trying to reduce my cravings so to avoid overdose. If that's their goal, then I would consider counseling the patient along those lines. Um, Thanks for that question.
Thank you. And then another quick question that we had come in. We have our policy forum coming up in February 18th. And so where can members that are joining us get up-to-date information on Arizona policies that affect rural health, especially around cannabis use?
That's a great question. AZMedMJ is a website put out by Arizona Poison Control. So they have a lot of great information about marijuana in general. Lena can put in the chat our personal website, which has a lot of these types of trainings, videos. So the example of the short video I showed, we have those and some FAQs. As far as staying abreast of changing policies, ADHS's website would be the best bet, as they have a news function there. And they have a really great kind of uh, way to kind of opt into specific types of information that you'd like to get notifications about on their newsletter platform. Um, let's see. And then of course the statutes. The statutes are there on the Arizona government website. And so that's where I go digging a lot if I'm looking to see, especially if things are in flux or changing. For example, with hemp, I think that's what we need to be looking for, is the change in the delivery coming down the horizon, and then the changes around hemp derived products versus cannabis products.
Thank you so much. I don't see any other questions in the chat. However, we will post your slides with your contact information. So I encourage anybody that has additional questions or specific questions to reach out directly. And I just want to thank you both for your time today. Thank you so much for being here and for educating us.
Absolutely. Thank you for having me, and have a wonderful rest of your day, everybody.
You too.